Welcome to Doctors on Call. I'm Jenna Miller. Pediatrics is the branch of medicine that involves the medical care of infants, children, adolescents, and young adults. When is it time for a well child visit? What about vaccines? Family physicians provide the majority of care for America's underserved rural and urban populations. In addition to diagnosing and treating illness, they also provide preventative care, including routine checkups, health risk assessments, immunization and screening tests, and personalized counseling on maintaining a healthy lifestyle. We'll learn more about these issues and much more on Doctors on Call with our guest nurse practitioner, Marley Palmer.
Presentation of Doctors on Call on Smoky Hills PBS is made possible in part by an underwriting grant from
Regional Hospital, experts, neighbors, friends.
Prospectively Healthy and Wellness Clinic, where health and wellness begins. Naturopathic medicine, IV therapy, and wellness services.
Our team at Smith County Memorial Hospital is always striving to exceed expectations of our patients and guests. Your family is our family.
Marley Palmer was born in Great Bend, Kansas, and raised in Larned, Kansas. After graduating from Larned High School, Marley attended Fort Hays State University, where she received her Bachelor of Science in Nursing in 2019. She then received her Doctorate of Nursing Practice from Fort Hays State University in 2023. Marley is board certified by the American Academy of Nurse Practitioners. Marley began her career as a registered nurse in the cardiac progressive care unit. She also gained experience in acute care, skilled nursing care, and pediatrics. Marley prides herself in serving the community of Larned and caring for her patients as if they were her own family. She enjoys all areas of family practice and caring for patients across their lifespans. Special interests include chronic care management, women's health, preventative health care, well child pediatric care for newborns and up, and acute care of all ages. Doctors on Call brings you information which may be useful to you when you see your own nurse or physician. Thank you so much for joining us tonight. We always enjoy seeing a fresh face on our show, so welcome. Let's go ahead with some of our questions. First of all, how do you decide whether to seek out a pediatrician or a family doctor for your visit?
Yeah, so I am a family nurse practitioner. That is the degree that I went towards. A lot of physicians in rural communities are probably family physicians. Pediatricians usually see from newborns up to 18 to 20 years old. So it's parent preference on whether they would want to see a pediatrician or if they want to see a family doctor. A lot of times I see the entire family, so that's why they choose to come see a family doctor, because you can see grandma, grandpa, mom, dad, and newborn all in one. With that question, I think that I want to touch on that it's important to establish care with one or the other specifically, only because when you do establish care with a practitioner or a physician, they know your normals versus your abnormals. So when your child is sick, they can really hone in on those abnormals and be able to accurately diagnose and treat your child.
Absolutely.
So we kind of push that to establish care.
Sure. And what is the difference between maybe going to see a pediatrician and going to see a nurse practitioner?
There's not much difference. We kind of practice the same. Before I worked at the family practice clinic, I actually worked in a pediatric office. Care is completely the same, except a pediatrician just has more, probably more knowledge on specifically pediatrics than they do have to have that broad knowledge on across the lifespan care.
Sure, and you were able to diagnose or prescribe medications?
Yes, I am able to treat from newborn to geriatric, diagnose medications, refer you out, whatever you may need. I can do all of that.
Excellent, very good to know. Let's talk about what a well child visit is.
So a well child visit is a preventative health visit that includes comprehensive head to toe exam. It also includes discussion about vaccines, growth and development, nutrition. Sometimes we talk about school and If there are any concerns that mom and dad have, we go over those as well. There's a lot of things that are included in a well-child visit. So
Sure. So maybe let's dig in a little deeper,
Yeah.
what those things are.
So in specifics, well-child visits, they are different for every age group. So 2 screenings that we really focus on in the younger kids, even through 18, one is a Bright Futures questionnaire. So it is a questionnaire that we print out and moms fill it out. Once a child gets to a certain age, I think at 10, they actually fill out their own as well. So it goes over, the first question is, do you have any concerns for your child? And they actually get to fill that in. And then it kind of asks them other questions. It also goes over milestones. So those are big during well childs. We make sure the child is meeting all their milestones, growing and developing appropriately.
Sure.
And then another one for birth to 30 months old is an ASQ screening. So that is an ages and stages questionnaire. It goes over the 5 areas of growth and development. So fine motor, gross motor, communication, personal, social, and problem solving. So they have check mark boxes where if they are doing this, if they're not doing it, or if they're sometimes doing it. And then we score that, and we can see how, if they're above the cutoff, at the cutoff, below the cutoff, and if they're below, we refer on to get them extra services. If they're at the cutoff, then that's great, that's where we want them to be. And then other screenings, 12 months is a big one. You usually screen for lead toxicity, so we draw a lead level, and then also we check their hemoglobin at 12 months. So the only other big screening is an MCHAT at 18 months and 24 months. That tests for autism. It's a list of 20 yes or no questions, and mom goes through and answers those, and then if there's any concerns or risk, we kind of address those during the visit.
Sure, absolutely.
Yeah.
Now, how often should a child have a well-child visit?
I will start at after 3. They should have a well-child visit at least once a year, is what I usually say. Before 3, moms and the childs probably think they see me every day. But between birth and 3, they come a lot more frequently, and it is at different intervals as they get older. So I like to see them 3 to 5 days after birth to make sure that they're doing okay, breastfeeding well, weight is doing fine. Then at 2 weeks, we do a weight check, and then we see 1 month, and from thereafter, we see them at a couple month intervals, and then we go to 3 month intervals, and so on.
Sure.
So yeah.
Absolutely. And is there anything a parent should do to prepare themselves and or their child for this well-child visit?
Yes, I always want moms or dads to talk to their child about what's going to kind of happen during a well-child visit, that I'm going to examine them from head to toe and kind of prepare them that we're going to look at your eyes, your ears, your mouth, your belly, all the things. And then I like them to have their questionnaires filled out and completed before they come in for the visit, if possible, only because they're long and they take a lot of time. So if they have time to sit down and do those questionnaires, then that is good so that we can review it during our office visit. And then sometimes they can kind of point out concerns when they're actually filling out the questionnaire. Then on my end, I review their growth chart, look at their last well child, make sure if they had concerns at their last well child that we address those and make sure that they've been addressed, so on.
Sure. Now, what are some red flags that you might see that could cause some serious concern?
So if a lot of times there's a question on the Bright Futures about bullying, and vaping is a big one too. So we always, if that is a yes, we always go over that. That's a red flag. Bruises on an exam is a big red flag. I always ask about nutrition, make sure that they're eating good, all the things. Other red flags usually on their screenings will come out. So if they're not meeting their milestones, that's usually a red flag. and we kind of look further into that to see if we need to get them some extra help, either in school or PT, OT, all of those kinds of things.
Absolutely.
Yeah.
Okay, let's talk about the younger children,
Yes.
babies, I guess, if
Yes.
you will, and when a parent should start them on solid foods.
Okay, so solid foods is always a big question for moms, kind of around once they start turning 4 to 5 months, moms start asking, like, hey, when can I start my child on solid foods or purees? I usually say once they're sitting up unsupported, so no boppy behind them, no extra blanket or pillows behind them, and they have very, very good head control, because their risk for choking is big if they don't have those things. So usually around 5 to 6 months old is when I say they can start their first purees.
Sure. And are the appearance of teeth, is that a sign that they're ready to start eating?
Not always, because I've had babies who don't have teeth until 12 months old. So it doesn't truly matter, I wouldn't say, on whether they have teeth or not. Does it help them be able to grind normal food? Yes, but not always an indicator whether they should start food or not.
Okay. Now let's talk about the car seats and when a child should transition from rear facing to forward facing.
Okay. Rear facing, I always try to tell my moms, keep them rear facing as long as they possibly can. That is their safest way of facing in the car. Typically, I say follow the height and weight requirements on that specific car seat. So if they meet the height or the weight, then they can turn to front facing, but I want them to max out that height and weight first before they turn to rear facing. Same with rear facing to a booster seat. I want them to max out that height and weight first before they go to a booster.
Sure. And how does a parent know that, or caregiver, that their car seat is properly installed?
They can, we actually have, I believe, down at our health department, somebody who kind of checks the car seats. They also, when they leave, get ready to leave the hospital, usually somebody goes, a nurse or somebody goes out and checks their car seat placement. And then I believe, don't quote me on this, but I believe that this police department also does checks.
Absolutely. Okay, so that's an important one.
Yeah.
Now you mentioned this a little earlier about autism. Let's talk about the specific screenings for autism.
Yes. Like I said, it's called an MCHAT, so it's a modified checklist that tests for autism. It asks 20 yes and no questions. It kind of asks questions about, does your child get scared of loud noises, the vacuum cleaner, do they like independent play versus play with other children, kind of hones in on their activities that they do at home and things. And then we look at that and take those questions into consideration. I wish I could tell you exactly what questions, but I know the numbers of the questions. 5, 7, and 12, I believe, are the questions. But if they are a yes, then we get concerned that they could be at risk for autism. So if they score at risk, I refer on to either neurology or Sunflower Services will also evaluate them under 3.
Sure. And what are some, if let's say a parent hasn't brought their child in for a well child visit for a little while or whatnot, what are some concerns that they might see, or what are some of the symptoms that they might see at home that they should maybe be concerned about?
Yes. A lot of times with autism, it kind of goes hand in hand with almost sensory processing disorder. So a lot of times kids won't like their clothes to touch them, or things feel funny. They make small hand gestures towards their face. They get scared of the vacuum, lining up toys, not liking change, really like a routine, things like that are kind of signs. But every kid's different, so you could have a kid who loves routine and likes to line up his cars and not at risk. So it just kind of depends, very case by case.
Sure. And at what age, we might have talked about this a little bit earlier, but at what age do the symptoms usually start appearing?
18 months is when we first start our screening. So that's kind of where I would say that you start to see those symptoms really start. Can be sooner, it can be later, but we do 18 months, and then we also check again at 24 months. I have had kids who may test at risk at 18 months and then not test at risk at 24 months, and it's just kind of a developmental thing. So I think that's why we do both, just to make sure that everything checks out okay.
Sure. And if a parent is maybe a little bit reluctant or, unsure about bringing their child in, what kind of advice would you give that person?
I always just say that it is totally up to them, but this is what my concern is, and this is what I would provide them with if they chose to seek other care or other help. But I always encourage that at least get the first screening, just to ensure if they truly are concerned.
Sure. And you'll sometimes hear of like the high functioning.
Yes.
What's the difference? Let's talk about that.
High functioning is usually they're very, very smart, have minimal symptoms. So they may thrive on routine and don't like change, but they don't have some of the other symptoms. So I can't really say whether I diagnose high functioning or not, or put them on the scale. I usually send to neurology, and then they kind of determine as that goes. I think it's hard to, I guess, assess at 18 or 24 months whether they're high functioning or not. But once they progress and get older, you can kind of start to see those signs of that.
Absolutely. Okay. So let's talk about when a parent can expect their child to start walking and talking.
Okay. So walking, usually I say about 9 months is when they should start pulling up on the couch or furniture of some sort. 12 months is usually where they're standing without support and start to probably take their first independent steps. I usually expect my kids to walk between 12 and 15 months. Every child is different. I always tell my moms that milestones are a guideline, not a hard stop. So if you come to me and your child's not walking by 15 months, we may wait and see how they're doing at 18 months, or I may call you back in a month and see how you're doing. So it's just super case by case, but usually 15 months I like them to be walking. Talking, that's a big one. So 12 months is usually mama and dada specifically, and one other word. Then at 15 months, they should be saying mama, dada, and 3 other words. 18 months, they should be naming 5 familiar objects besides like mom and dad, and then 2 body parts. 2 years old, they should be saying at least 50 words, and then it kind of goes up from there.
Sure.
So at least by 2, we like them to have 50 words. But.
Absolutely. And is there any truth behind the importance of crawling, not skipping straight from sitting to walking? How important is it to crawl?
I still go by the guidelines that they should crawl, because I think it's good for them to build those kinds of muscles and the strength. Some babies do go straight from sitting to walking, and they just have that strength. So it's not bad for them if they go from sitting to walking, but I always like them to crawl because it just builds those muscles.
Absolutely. Okay, so let's talk about cold and flu season. Are we still in it? What should we do for not only our children, but for ourselves to keep our children healthy?
Yes, I do believe that we're still in it. I just recently had cases of RSV, so I think we're still kind of in it. I hope it's tapering off soon. To keep ourselves healthy, we need to do very good hand washing, making sure we're disinfecting common surfaces. So, kitchen table, door handles, car door handles, all of those good things. Some people recommend calcium and zinc to kind of keep you healthy. Emergency people do drink. A lot of it is in just like hand washing, covering our mouths when we cough or sneeze, things like that. A big one for moms that come to see me is, when can I send my kid back to school? I always tell them 24 hours fever-free without fever-reducing medications of Tylenol and ibuprofen. The risk of sending your kid back to school too early when they're on the fever reducing meds can always spread that illness.
Absolutely. Now, you mentioned RSV. Can we
Yes.
talk a little bit more about what that is, and is there any contagion behind it? How does that develop?
Yes, so RSV is a viral infection. So it is very contagious. A lot of times it causes babies to wheeze. They might have lower oxygen, cough, runny nose, congestion, fevers. Adults can get RSV as well. I have seen that a lot this last year is teenagers with RSV. Similar symptoms. A lot of it is treating symptomatically. So breathing treatments if you need them for the wheezing or the bronchiolitis, which is the inflammation in your lungs. Cough medicine, antihistamines, things like that. A lot of it is just treating your symptoms.
Sure.
Yeah.
Is RSV and COVID similar, or are they very different?
They can be similar. A lot of times, I always tell my patients, I've been wrong before when I think they have RSV or something and it comes back COVID. So they can be similar, but they can be different too. So we have a viral panel that we use to swab, and it tests for influenza A and B, RSV, and COVID all in one swab because they all present pretty similarly. So we can test for all of those in one swab and come up with what our diagnosis is. I can guess all day long, but if I don't have a diagnosis, then it's hard for me to say.
Absolutely. Now let's jump to another problem, that's childhood obesity.
Yes.
What are you seeing with that right now?
Childhood obesity is a major public health concern. Actually, I believe the last time I had looked into it, about 1 in 5 children have childhood obesity, which is a huge portion of the pediatric population. So I think we really need to focus on diet and exercise in our younger population. We've gotten into, video games and watching TV and not spending time outside as much as we did as we were kids. So I think we need to encourage that as providers, as parents, as school teachers, all of that. I get nervous about childhood obesity because it can lead to increased risk for adult obesity, diabetes, cardiovascular issues. So I just worry about those kids having worse comorbidities as they age.
Absolutely. And what kind of suggestions do you have to get families to eat healthier?
Yes. So I always say reclaiming the table. A lot of families don't eat dinner at home anymore. I think that's a big one is that you set a meal time and you eat dinner as a family, no electronics, no phones, nothing like that, and encourage them to eat a home cooked meal. Portion sizes are good when we're considering healthy eating. A lot of times, I don't think we realize how much fast food we eat until we actually think about it more. So decreasing like fast food, sugary drinks, all of that. I also say be a good role model because kids do what we do. So if a parent is sitting down at the table eating healthy, a child will be more likely to sit down and eat healthy.
Absolutely. And besides the obesity problem that we have, what are the other benefits of eating healthy?
Good. It's good for your cardiovascular health. It is also good for just your, health in general. Helps your eating healthy, helps boost your metabolism, keep good energy. I feel like you feel a lot better when you just eat better, So yeah, just kind of your overall health, it very much changes.
Absolutely. Excellent. Well, thank you so much for being our guest tonight. We
Yeah.
enjoyed and covered a lot of great information. That's Marley Palmer from Pawnee Valley Community Hospital. On our next Doctors on Call, we'll be discussing myofunctional therapy with Dr. Paul Jones and Dr. Courtney Cava from Cedar Lodge Dental in Hayes. You can email questions to us for our next program. That address is doctors@shptv.org. Thank you for joining us for Doctors on Call. I'm Jenna Miller.
presentation of Doctors on Call on Smoky Hills PBS is made possible in part by an underwriting grant from
Russell Regional Hospital. Experts, neighbors, friends.
Prospectively Healthy and Wellness Clinic, where health and wellness begins. Naturopathic medicine, IV therapy, and wellness services.
Our team at Smith County Memorial Hospital is always striving to exceed expectations of our patients and guests. Your family is our family.